Joining us on the program now is Marcee Chmait, who's president of SpendWell Health. And SpendWell Health, which is the Cambia company, has created a leading marketplace that connects care seekers with care providers. And Marcee is one of this year's Industry Innovator Award winners as well. Marcee, good morning.
Good morning, everybody.
Hey, nice to have you on the program. Appreciate you being with us. Give our audience a little bit of background on SpendWell Health, if you would, please.
Sure, absolutely. SpendWell is an online marketplace, and our mission is to really modernize how the healthcare ecosystem and its infrastructure can change to serve the specific needs of the consumer and the provider. We encourage consumers to take shopping and transparency to the next level, where they can actually be able to buy healthcare services at real prices from providers that are actually pricing their services, which is a little bit different, right? So we're really trying to streamline, the supply chain, if you would, in terms of connecting consumers and providers in a very direct way.
So Marcee, who should drive cost and real prices in the healthcare marketplace, and why?
So it's interesting. So I've been in this business for 27 years, and most of it on the health insurance side of the business. And what I've come to really appreciate and understand is just the complexity around how we, quote unquote, have prices in our ecosystem, and all the supply chain claims processes around administering the negotiated discount. And what I've really come to understand, and what SpendWell has learned in the last few years, is that the providers really need to be in charge of the supply, right? So in like every other market where you have a manufacturer or other suppliers, really mandating the price, and the price then fluctuates based on demand, that needs to happen in healthcare, and it's not happening in healthcare, and it should, right? So the negotiated discounts that we have, for the most part, continue to inflate year over year because of how the providers are billing, and I think we're all very accustomed to that. But what we're finding is that when providers know that they're pricing their services directly to the consumer, because the consumer is on the hook more and more for all their out-of-pocket costs, especially if they're under their deductible, that the prices on our platform compared to the insurance company's regional, averages or their negotiated rates are, up to 27% below what a health plan can typically negotiate.
Yeah. So what are the biggest challenges to achieving a simplified supply-demand market for healthcare?
Well, I think there's a lot of challenges, right? So creating an e-commerce environment or taking medical price transparency into next gen, where you actually have real prices, there's a lot of headwinds, but I think the consumer and the provider are actually very willing and able. So the challenges are this. One, those that really have the relationship with the healthcare consumer, whether it's the health plan as a payer or the employer as a payer, really have an opportunity to unleash a real shopping experience, right, and giving those tools directly to the consumer. Two, again, with the health plans especially owning the supply or controlling the provider, there is an opportunity to say, hey, we're going to do business in a new way. We're going to make it easier for us to do business together. And it's all about behavior change, right? So getting those two things aligned, changing behavior from, going from kind of blindly seeking care and then being surprised when all your bills come, to proactively, seeking care and being able to compare and shop and buy is a new behavior. So similar to how CDHP in the early 2000s or even the HSA plans and or telehealth have even transformed, those are some of the headwinds that are similar.
When you look at alternative payment models, where do you think they will go? And you're looking on the horizon. Are there any other payment models that are suited for the consumer and the consumer movement right now?
Yeah, absolutely. So the market right now is very focused on value-based models, which I think play a significant role in helping us achieve, cost control as well as, better outcome. But what I am concerned about is that the consumer is not actively at the table in those discussions. And so whether it's, I think the next opportunity really is bundled payments and making sure that bundled payments along with value-based payments can come together, right? So if a consumer is still having to buy the majority of their care as out-of-pocket increases, then there has to be a way for them to consume that care very discreetly and distinctly. And so bundle payments would be top of mind, and being able to then buy that bundle at a known price is very important.
Yeah. So when you look at this market, what do you think are the primary factors that will create a sustainable, people-centered healthcare system?
I actually think that if the payers really focus on delivering ultimate value to their members, to their consumers, as well as to their providers, and really take kind of a new role and start to use technology to replace a lot of the complex infrastructure, those types of transformations will happen. And what we're seeing at SpendWell is that when third parties actually start to, take a back seat, if you would, prices fall, consumer satisfaction is high, provider satisfaction is high, and it doesn't mean that, we still don't have some of the very important things like clinical management and all those types of services. It's just that when it comes to the price is really the crux of why a lot of our costs continue to go up, because there's no real price in healthcare.
So tell me how SpendWell is addressing these challenges. What are you guys doing to help address these challenges?
Yeah, so we're a platform solution that that payers actually use to help modernize how they're addressing a couple of things. One is their digital health strategy, digital transformation. Two, around their payment reform, right? And then three, around their contracting. So as the consumers and providers become really central to the theme of reform, our platform is really helping connect the supply and the demand in a very new way, and taking out a lot of the complexities that payers have invested in.
So what's the SpendWell Health business model?
So today the SpendWell Health business model is a software as a service platform that is enabled at the payer level. So whether you're a large self-funded group that works with a TPA, we can put this platform in to help connect your supply and demand, your employees and your providers. Or on the health plan front, if you're a health plan, we actually are able to connect into your current infrastructure and help modernize both your claims as well as your electronic payments, as well as your electronic EDI infrastructure.
Marcee, again, I want to congratulate you for being recognized as an IHC Industry Innovator Award winner. So, as an innovator, look ahead and give us kind of your wish list on what you hope to see for the future of healthcare here.
Yeah, I would love to see the future of healthcare just be known and quantifiable, right, to the people that consume it, and that everything that is hard and complex and unknown is removed. I mean, we need to be modeling our industry as the financial services or banking industries have done, making it incredibly simple for end users, knowing, however, that we're in a regulated industry and there's a lot of complexity. At the end of the day, our consumers and our providers, that shouldn't matter. So we really need to be working in a very consumer-centric, frictionless, seamless, and economically sustainable environment. That would be my wish.
That's great. Marcee, as always, it's a pleasure having you on the program, and I look forward to seeing you next week. And to our audience that's going to be with us at IHC Forum West, Marcee will be there, and she'll be speaking in a panel, plus receiving her award at the awards dinner. So, Marcee, again, thank you. Have a great weekend, and I will see you first of next week.
Thank you, guys.
Thank you. Take care.